You might know that the thyroid, a butterfly shaped gland in the neck, produces several important hormones, but that's not all it does. It's a small gland with a big job, and it can impact everything from your metabolism and body weight to your temperature. In this video, let's focus on the relationship between the thyroid gland and blood sugar. What does thyroid disease have to do with insulin resistance? What do you need to know about your thyroid hormones in relation to glucose metabolism? Keep watching for answers to these questions and more. The thyroid gland and diabetes mellitus are related because both are involved in the metabolism, blood sugar levels, and insulin. First, think about how the body uses glucose, meaning sugar, for energy. This requires the help of the thyroid gland, which produces hormones that regulate your metabolism and turn food into energy. This means that if the thyroid gland isn't functioning in the right way, maybe some of what you eat won't be converted into energy. This can lead to high blood sugar levels or hyperglycemia, which puts you at greater risk of diabetes mellitus. High blood sugar levels can lead to additional problems like metabolic syndrome, a group of health problems including high blood pressure, unhealthy cholesterol levels, and excess fat around the abdomen. Furthermore, if you have metabolic syndrome, you might be at a greater risk of heart disease and stroke. Additionally, if you have hyperthyroidism, which is an overactive thyroid gland, meaning it's producing too much thyroid hormone, then it might use up insulin more quickly, and insulin is needed for your body to use glucose as energy. While these aren't the only connections between the thyroid gland and blood sugar levels, more on this in a moment, they are two of the more prominent ones. Research tells us that thyroid disease is a potential factor in glucose homeostasis and insulin resistance. One study that involved 5,727 participants found that both hyperthyroidism and hypothyroidism, which is when the underactive gland doesn't produce enough thyroid hormone, could be associated with insulin resistance in their own ways. Other research points to hypothyroidism specifically, saying that it can increase blood sugar levels. And interestingly, individuals with diabetes mellitus as well as hypothyroidism might also have higher levels of hemoglobin A1C or HbA1c, which reflects the average blood glucose levels over a 3-month period. How exactly is this possible? Well, thyroid hormone levels impact glucose homeostasis by affecting pancreatic B cell development along with glucose metabolism. Glucose metabolism happens in multiple organs such as the liver and pancreas, in addition to the central nervous system, muscles, and gastrointestinal tract. What this means is that thyroid disease can be more prevalent in people with diabetes mellitus, and people with diabetes mellitus might be more likely to experience thyroid disease. In addition, if you've already been diagnosed with diabetes mellitus and then find out that you also have thyroid disease, if left untreated, it can be more challenging to get your blood sugar levels under control. There's one more link between thyroid disease and diabetes that we want to cover. Certain types of thyroid disease are autoimmune disorders. These include autoimmune thyroid disease or AITD, Hashimoto's thyroiditis, and Graves' disease. Type 1 diabetes is also an autoimmune disorder, and type 2 diabetes may have roots in an autoimmune reaction, although more research is needed to better understand this relationship. Some research says that anywhere from 17% to 30% of individuals with type 1 diabetes also have autoimmune thyroid disorders because of the sharing of a common genetic background. Plus, take into consideration that if you have one or more autoimmune disorder, you're more likely to develop another. So, getting thyroid disease under control is essential to optimize your overall health, especially if there is concern for developing diabetes or other autoimmune disorders. Thyroid disorders are somewhat common. More than 12% of the American population will experience thyroid disease at some point in life. Diabetes mellitus is also fairly common, affecting about 11% of the population. Thankfully, both can be treated and managed under the guidance of a qualified healthcare provider. The first step is to better understand what's currently happening in your body. Blood work can offer valuable insight into your thyroid hormones and glucose levels. eNational Testing's Thyroid Health Panel checks the thyroid hormone levels, T3, free T4, and TSH, And our diabetes screening is suitable for individuals who are at a higher risk of developing diabetes or may already have it. It's also for people with prediabetes. All of these tests require just a simple blood draw, providing results within a couple of business days. Afterward, you can follow up with a clinician to discuss the next steps. We have more than 2,000 locations nationwide, so you never have to go far to find us. Simply order your lab work online, receive your order form instantly, and visit the location most convenient for you. We even offer same day service, and this goes beyond blood work. Thyroid disease and diabetes mellitus can wreak havoc on your body and seriously impact your quality of life. Anyone experiencing symptoms can tell you this. Things like your energy level, body weight, sex drive, and so much more can feel completely out of control. The thyroid gland and your blood sugar have an incredibly unique relationship. Get ahead of your wellness, steer clear of insulin resistance, take control of your thyroid hormones, achieve healthy glucose levels, and avoid long term health complications.